Hello friends, I am Dr. Aman Ahuja, CEO of Cosmodent India and a dental implantologist. Today I'll be giving you an insight about dental implants. What are dental implants? When do you need it? What is the costing of it? There is a lot of confusion amongst the patient when it comes to dental implants. So in this video today we'll explain you about dental implants. So the first question is, what are dental implants and when do you need them? So basically, if any of you have missing teeth which may be removed due to cavity, trauma or any other reason, the solution for it is a dental implant. Dental implant is nothing but a screw made of titanium which is placed into your jaw by a small surgery, and then over it a crown which looks like your teeth is fixed to it. The second question which people commonly ask, are there any side effects of dental implant? What is dental implant made of? Basically, dental implant is made of titanium. Inside a body, if you need to place any implant to join the bone, for example if you have a fracture, titanium screws are used. They don't have any side effect. However, there are multiple things which have to be evaluated before doing a dental implant. How is the person's bone density, whether he is having a diabetes which is controlled or not, and many other factors. So dental implants are majorly used in adults these days. Any person having age of 16 and plus, when his bone growth has stopped, we can perform dental implant surgery for them. There are certain prerequisites which are required to be done before doing the surgery. The basic test is called OPG test. It is an X-ray which is a two-dimensional X-ray which gives us idea about the density of your bone. So in case if you are looking for dental implant, the first X-ray which you have to do is an OPG X-ray. The second X-ray which is required for the dental implant is known as CBCT. It is nothing but a three-dimensional image of your jawbone. Based upon that, we calculate the exact size of the implant which you require. A couple of blood tests are also recommended at times if you have diabetes, to check your blood sugar levels. In case if the blood sugar levels are higher than 7.2 HbA1c, we recommend you to visit a physician and reduce your diabetes through various means, either through medicines or dietary precautions. Below 7.2 HbA1c, the dental implants can be safely performed. So once you have performed all these tests and you are ready to get your dental implant, the second question which people ask me is, how much time will it take for the dental implant surgery? Basically, it can take from a single day to 3 months. It depends on your bone density. If a person is having a strong bone in which the density of the bone is very high, we can also replace the teeth in the same day. It is known as same day implant. However, if the patient bone density is weak, in that case we have to wait for a period of 3 months in which the implant is placed inside the bone first, and then we wait for 3 months for the implant to integrate with the bone and become strong, and then we give you the final crown. However, on the same day you will also receive a temporary crown which will be removable. So in short, it may take you from one visit to a 3 months period to get a dental implant done. One of the most common question also asked is, are dental implants painful? In the latest technology today, we have different means of anesthesia available, from local anesthesia to gas anesthesia, also known as conscious sedation, and general anesthesia. Basically, the implants are virtually painless after the anesthesia is received. So after the surgery, antibiotics and analgesics are given for you so that you don't have any post-operative pain. However, out of 10 people, 1 or 2% may get slight swelling, for which medicines are given, and eventually within a period of 3 days you are fit like normal. Always you need to compare your bone density and the type of implant. Based upon both the factors, we give you a final end product. So if a person is having a less bone density, in that case a person will require a more expensive implant so that it can adapt to the bone nicely. In India, there are majorly 3 categories of implants available. The higher category is Swiss made or US made implants. The company names are Noble Biocare, Straumann, Megagen, These are the three topmost brands available in case of conventional implants. The second category is Korean brands. Companies like Ostium, Dentium are also very suitable for economical segment of the implants. However, if you're looking for the cheapest implants that are available in market, Israeli implants are the cheapest which are available in market. They are available with brand names like Aden, Abident. Nowadays there are many Indian companies also which have come with low costing dental implants by name of Genesis and many other companies. So my suggestion would be, rather than looking for the company, look for a good doctor and consult with him. Based upon your bone factors, he will suggest you a good company implant himself. Now coming to the cost of dental implants in India. No two people can have a fixed dental implant costing because there are 3-4 different parts available which when combined together can provide you a final good result. The 4 parts are the dental implant, the abutment, the crown, and in case if you need any bone graft. So a combination of all this would give you a final cost of your dental implant. The average costing of dental implants which you will find in market range from 15,000 rupees can go up to 50,000 rupees based on the above mentioned factors. So I would recommend you to visit your dentist, get the OPG X-ray done, get the CT done, discuss which implant will suit you the best, and then go for a final implant. All these different companies come with different kinds of warranty which is there for you. Before you go for a dental implant, always ask your dentist how much is the warranty on your dental implant, what are the future consequences, in case if you have any problem, will the dental implant company replace the product for you, because each company has different criteria. So always ask the warranty of dental implant. Generally a good dental implant lasts for lifelong. Once done, it never creates a problem, but a study has to be done on your case particularly to understand which implant system will be best for your case. The last question which arises in your mind is how to maintain your dental implants. Do I have to visit dentist every now and then? How do I clean them? The answer is you just have to take care of your dental implants like your natural teeth. All you have to do is brush twice and use a water floss. Water floss is nothing but an advanced version of the regular floss and threads we used to have before. It is a machine like this which you have to use daily after brushing. It helps to cleanse the area between the dental implants and the gum so that no food gets stuck inside and you have any problems. Hope I have answered all your dental implants query. For any more questions, you can drop down in comment and share us your X-ray with us, the OPG X-ray which I told you, for more dental implants queries which you have. Thank you.